Mr. Gonzalez, how are you today?
I'm very fine, thank you.
Good. My name is Kira Anderson. I'm an occupational therapy student from Texas Women's University. Today, I am going to be taking your body through some different cardinal planes of movement. And then I am going to palpate three different areas on your shoulder joint. Are you okay with this?
Yes, I am.
Okay. First thing I'm going to do is have you stand in anatomical position, which looks like this.
Okay.
Okay. The first plane of movement we're going to do is called the sagittal plane. This divides your body into left and right halves. Okay? Movements in the sagittal plane include flexion, extension, hyperextension, plantar, dorsiplantar flexion. Okay? I'm going to show everybody one of these moves in the sagittal plane. Elbow flexion. This is occurring in the sagittal plane. The next cardinal plane of movement that we're going to talk about is the frontal or the coronal plane. This divides the body into anterior and posterior portions. The movements that are involved in the frontal plane include elevation and depression of your scapula, upward and downward rotation of your scapula, inversion and eversion of your foot, abduction and adduction of your shoulder, radial and ulnar deviation, and lateral flexion of your trunk. Okay, I'm going to take your shoulder through a movement in the frontal plane. Adduction, abduction. The next plane we're going to talk about is called the horizontal plane. This divides your body into superior and inferior portions. The movements that occur in this plane are shoulder, external and internal rotation, horizontal, abduction and adduction, pronation and supination, protraction and retraction of your scapula, and rotation of your trunk from the right and left. I'm going to take your body through one of these movements now. I'm going to bend your elbow and bring you into internal rotation and external rotation in the horizontal plane. Those are our cardinal planes of movement. Now I'm going to palpate some different portions of your shoulder area. The first thing I'm going to palpate is the spine of your scapula, which is on the back of you. So I'm going to go over to your posterior side and palpate your spine of the scapula. I'm feeling for your scapular border now. I feel the vertebral border right here, and I'm going to work my way up towards the top portion of your scapula, and right here I can feel the spine of your scapula. The next thing I'm going to feel for is called your acromion process. Okay? Once I find the spine of the scapula again, I can work my way over here and find your acromion process, which is right here. The next thing I'm going to palpitate for is the head of your humerus. Head of your humerus is right here. Okay, thank you very much, Mr. Gonzalez. We are now done.